Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Hi there. So what is our medication of choice today? Our medication of choice is known as Clomid. So Clomid generic name is also known as Clomiphene, and as you've probably heard, this medication is used in patients who have female infertility. So this would be used in patients who are trying to conceive, and also this medication can be used in male patients who have low sex hormones. So these this condition is known as male hypogonadism. So these are the two subsets of patients that usually take this medication. So for patients who are trying to conceive with Clomiphene, this patient usually takes about 50 milligrams orally for 5 days, starting on the 5th day of their menstrual cycle. So usually your doctor will go through, your menstrual cycle and kind of point towards, okay, this is the 5th day of your menstrual cycle, and this is when you should start taking this medication. Also, this medication can also be taken as a 100 milligram tablet, which is given as a single dose. And this is usually taken for 5 days, and it's initiated as early as 30 days after your previous dose. So this medication can be tried a couple of times to see if how effective it is, and once patient becomes pregnant, then they stop the actual medication. In patients who are using this medication for male gonadism, hypogonadism, this patient usually take about 25 milligram orally once a day. They can take it about 25 milligram every other day as well, and this can go up to about 50 milligram every other day as well. So let's talk about the side effect of this medication. So the side effect of this medication includes abnormal bloating. So you may feel a little gassy, or your stomach may feel a little swollen. These is a common side effect. Also, this medication can cause nausea as well as vomiting. It can cause flushing, where there's kind of like a redness going on, or around the face area. Also, this medication can cause headache. It can cause back pain, breast pain. It can cause breast pain, visual disturbances. So your eyes may get a little blurry, or you start feeling different visual sensation around your eye. Also, patients may have trouble sleeping while on this medication, as well as feeling nervous, and also hot flashes. So these are common side effects. As I mentioned, it doesn't happen to everyone, but just in case if you start noticing this side effect, there are things to mention to your doctor on your next visit. So let's talk about serious side effect that you definitely want to stop the medication immediately and contact your doctor for. So some serious side effects of this medication include low mood conditions. So this might be like, the patient feeling depressed. Also, if you start feeling any weird chest pain or abnormal chest pain, or an abnormal vaginal bleeding as well, which is kind of like spotting or bleeding in between your menstrual cycle, then you definitely want to reach out to your doctor immediately to make sure that this is not because of another condition that you're going through, and to make sure that this medication is also appropriate for you. Also, if you start noticing a terrible back pain, you definitely want to reach out. If you start noticing any intense lower abdominal pain, then you definitely want to reach out to your doctor immediately as well. Also, if you start noticing consistent blurred vision, or you start seeing flashes or spots around your eye, or you start seeing spots, then you definitely want to make sure you're reaching out to your doctor immediately. That way they can figure out if this is a side effect you're getting because of the medication. All right, so what are some things to know about this medication? I've heard mixed stories with this medication. I've heard stories of patients who said they weren't pregnant until they used this medication. So I feel like this medication is definitely worth a try based on what I've heard. And I've seen patients who are like, I tried it, it didn't work. Here I am. So it really just depends. Usually in patients who are trying to conceive, you want to start with, medications with lower side effect, or medication that are kind of manageable when it comes to taking, most especially oral tablet like Clomid is more easily managed compared to you having to give yourself a shot or an injection in your stomach area. So this medication is definitely worth the try if you are considering it. This drug, like I said, is used to increase your chances of getting pregnant. So pregnancy test is usually done before starting this medication to make sure that you're not already pregnant. That way you're not just taking this medication to, and getting all the side effects when in actuality you're already pregnant and there's no need. Also, with this medication, it can increase your chances of having more than one baby. So it can increase your chances of having a twin. You can increase your chances of having a triplet. So it just kind of increases the chances of having. So this medication can increase the risk of what they call tubal pregnancy. So patients who are diagnosed with tubal pregnancy, they most likely have to get the egg removed. With tubal pregnancy, what's actually going on is the egg is actually stuck before getting to the uterus. So if the egg is growing outside of the uterus, then that is not good. So they will have to actually go in and have, take the egg out. That way the patient is not at risk, as this tubal pregnancy can be very deadly. Also, if you do not ovulate or get pregnant after 3 courses of this medication, then you don't want to take it anymore and just reach out to your doctor to see whatever is the next line of therapy that you should be taking. However, do not stop this medication unless you're told to do so. Your doctor has a more comprehensive medical history for you, so they're able to tell if it's more appropriate for you to use it more than 3 courses of time. But the general rule of thumb when it comes to this medication is 3 courses, and if you don't notice any pregnancy or ovulation while you're on it, for you to stop it. All right, so let's talk about other things that you need to know while taking this medication. So if you have any health problem history, you definitely want to mention that to your doctor before you start taking this medication. So health problems or health disease that you definitely want to mention to your doctor if you have before taking this medication include any form of liver disease. If you have any ovarian cyst issues before starting this medication, then you definitely want to report to your doctor. If you have had any history of pituitary tumor, then you definitely want to report as well as an adrenal gland disease or thyroid gland disease, or any consistent vaginal bleeding. You definitely want to reach out to your doctor to make sure that this medication is actually appropriate for you before starting the medication. Also, with this medication, it's very time sensitive, so you want to make sure that you're taking it as prescribed, and most likely at the same time every day. So making sure that you're staying consistent in terms of the time you're using the medication, making sure that you're staying consistent in terms of how you're using the medication. That way it can work effectively as prescribed. Also, with this medication, you want to make sure that you're keeping tabs, making sure that you're doing pregnancy tests in between, or making sure that you're checking for your ovulation as well. The doctor might actually ask you to check your temperature in between taking this medication, as it is known that during ovulation period, the basal temperature or your body temperature kind of changes for that duration of your ovulation period. So usually the doctor will tell you to keep tabs of that, because once you start feeling that, temperature change, then most likely this is a time to get active and start making some babies or get in the process of making a baby. All right, so make sure that you let your doctor know if you miss any dose while you're on this medication. That way they can redirect you and let you know how to kind of recuperate the dose that you miss. You definitely don't want to double dose yourself just because you miss one dose. So making sure that you're taking your dose as prescribed, same time each day, and for the duration of time that you're supposed to use it for, and for that course of therapy. I hope this medication really works. And also we hope to see more of you. Make sure you hit the like and subscribe button if you did enjoy this video and you would like to see more of our videos here on YouTube. Thank you for watching and stay blessed.